Hightower, and today we're going to be doing a head-to-toe assessment. This is my client here. Can you tell me your name and your date of birth, please?
My name is Hightower. My date of birth is May 18th, 1991.
Okay, do you know where you're at today?
Yes, I'm at home.
Okay, and you can tell me who the president is?
Joe Biden.
Okay, very good. Spatial expression is normal. His mood and affect seem to be normal as well. He seems to be happy. His speech is clear. He does speak English. He does not have any noticeable physical deformities. Do you use any type of mobility device to get around?
No.
Okay. And no involuntary movements of anything? Arms, legs?
No.
Okay, good. Can you tell me what brings you in today then?
I'm just here for an annual exam.
Okay. Alrighty, well first do you mind if I use my hands to do my assessment today?
Sure.
Okay, so we're going to be taking a look at your scalp. His hair is brown, cut pretty short. There's not any type of pests or lacerations or anything noted. Also, we'll be checking his eyebrows and his eyelashes. Okay, good. Your hygiene appears to be normal. You take a shower and brush your teeth every day.
Yes.
Okay, very good. Here we're assessing his skin. It is fair. It is warm and dry. There aren't any type of acne or lesions or anything like that noted. Okay. We're going to check your symmetry, so can you raise your eyebrows for me? Good. Puff out your cheeks. Good. Smile for me real big. Okay, and then stick out your tongue. Okay. Very good, thank you. Alrighty. Next, we are going to feel kind of around your jaw area. So I'm going to have you open and close your mouth a couple times for me. Good. And there's not any popping or crepitus noted. Alright, I'm going to feel around on your sinuses. Any pain or tenderness when I'm doing this?
No.
Okay, very good, thank you. Alrighty, I'm going to take a minute here to look at a spot on your arm. So this is a birthmark right here on your wrist. It is asymmetrical. There is an irregular border. The color is kind of a deeper red or purple. It's about 1/4 of an inch long. And has that stayed looking the same as far as long as you've had it? Not changed any? Good, so there's no evolving there. Very good. Okay, next I want to take a look at your nose. So we're just taking a look at the outside of his nose, checking there are some freckles, but there's not any type of lesions, deformities, anything like that there. Okay, next what I want you to do is if you will take a finger and kind of plug a nose and can you sniff for me? Good, and we'll do the same thing on the other side. Good, thank you. Alrighty, next we're going to be taking a look at his mouth and lips. So his lips are pink and moist. Can you smile real big for me? Good, there's not any decaying, any problems with your teeth or anything?
No.
Okay, good. Can you say off for me? Okay, here we're taking looks, making sure that his uvula is midline, noting his soft and hard palate. His tonsils are normal, which is a 1+. Also checking his tongue. Good. And that is pink and moist, no cracking or anything noted. Very good. Thank you very much. Okay, next we're going to take a look at your neck. So what I'm going to do is I'm going to feel kind of in a circular motion. I want you to let me know if there's any pain or tenderness. Just feeling your lymph nodes here. Okay, any pain or tenderness?
No.
Okay, I'm going to feel your carotid pulse. Take a listen as well. So with the bell of my stethoscope, I'm going to take a listen and have you take a deep breath and hold it for me, okay? Okay, go ahead and let it out. I'm going to have you do the same thing. We're going to take a listen on the other side. So another deep breath and hold it. Good. So we're just making sure that there aren't any bruise noted. Okay, I'm going to take a feel of your trachea. Any pain or tenderness when when I'm doing this?
Nope.
Okay, good, making sure that everything's midline. Alrighty. Okay, next we are going to check your range of motion. So if I can have you bring your chin forward to your chest. Good. And then we'll kind of have you extend your head backwards. Good, and then if you can take each ear to your shoulder. Good, and then if you can kind of rotate your neck for me. And then we're going to do the same thing against pressure. You will lean forward. Good, lean back for me. To the side. Good, same thing on the other side. Very good, thank you. Okay, next we're going to take a look at your eyes. So we're going to do the Snellen test. So we're going to be about 20 feet away, and I want you to cover up your right eye for me. And I want you to read the smallest line that you can.
DEFPOTEC.
Okay, good, that's 20/20. Now cover up your left eye. Now with your right, read the smallest line.
FELOPZD.
Good, now it's 20/25. And then with both eyes, read the smallest line.
DEFPOTEC.
Good, and so that together, that's 20/20, which is normal. You don't have any contacts or glasses, so has your eyesight seemed to change at all?
No.
Okay, very good. Next, I'm going to be checking your peripheral vision, so I'm going to have you kind of look straight ahead, and then if you will cover up your right eye for me. Okay, and I want you to tell me whenever you can see my fingers, okay?
Okay. Okay. Okay.
Okay, and same thing on this other side. Cover up your other eye.
Okay. Yes. Yes.
Okay, very good. Okay, next I want you to follow my finger. I'm going to check your 6 positions of gaze. Making sure that your eyes are tracking together as they should. Very good. Okay, can you pull your eyelids down for me? We're taking a look at your cornea, your sclera, your conjunctiva, looking at the colors, making sure that those are as they should be. There's not any discoloration, drainage, anything like that. Any issues with your eyes?
No.
Okay. Very good. I'm going to check your pupils, so if you look straight ahead for me. Good. So we're making sure that your pupils are equal, reactive to light, round, and so the next to check your accommodation, I'm going to have you look at that water bottle across the room. Good, now focus right here on my finger. Good. Accommodation is present. I do not have an ophthalmoscope, so I'll just use this pen to pretend. So I would be assessing your left eye with my left eye, looking for the red light reflex. Good. Good. Okay, next we're going to take a look at your ears, making sure that the skin is intact. Any pain or tenderness in your ears?
No.
Okay. And then we would use our otoscope, and we would pull the ear up and back. We would carefully insert, looking at the ear canal, which does have some wax buildup. Looking at the tympanic membrane on both sides, making sure that it is gray and shiny. Okay, next we're going to do a hearing test. So I'm going to kind of come from behind. So if you will kind of push on this part right here, I'm going to whisper some 2-syllable words, and then I want you to repeat them back for me, okay?
Football. Breakfast. Hockey.
Okay, same thing with the other side.
Soccer. Bacon. Summer.
Very good. Any problem with hearing that you've noticed?
No.
Okay, very good. So next, I want to double check your thoracic configuration. So if you will kind of move this arm, I want to kind of feel here, making sure that those are about 1 hand's length against 2, making sure that the ratio is appropriate. Can you kind of make an angle here on your ribs? Good. So we want to make sure that the angle here is at least less than 90 degrees, and then that there's a downward sloping of your ribs. Let me take a feel. Good. Alrighty. So next I'm going to take a listen to your heart. We're going to listen to all 5 spots. Checking for any type of pulsations, heaves, thrills. Okay. So here we're listening to the aortic, the pulmonic, the tricuspid, the mitral, and we'll listen to the apical for 60 seconds. And then we would also feel, making sure that there's a regular rate and rhythm there. Which there is, good. Okay, next I'm going to take a listen to your lungs. Also, his S1 would be most prominently noted at his apex, and his S2 would be most prominently noted up here at the base of his heart. Okay, now to listen to your lungs, I'm going to have you take some deep breaths. Good. So now we're going in a position to listen to his lungs, top to bottom, side to side. Good. Good, as lungs are clear. I'm going to come from the side, deep breath. Listening to both spots here. And a deep breath. And a deep breath. Very good. So if you will turn to the other side. Good, we're going to do the same kind of pattern, listening to his lungs, deep breath. Good. Okay, we are going to check for symmetry here, so I'm going to have you take another deep breath for me. Very good. I'm going to check your spinous process. Any pain or tenderness here?
No.
Okay, and then I'm going to check for CVA tenderness. You're going to kind of feel a thump back here. Any pain or tenderness?
No.
Same thing on this other side.
No.
Okay, go ahead and flip back around for me. So we'd also be noticing the skin front and back, making sure that there's not any type of abnormalities. We're also going to be checking his skin turgor here, checking for any tinting, making sure that there's a brisk response, which there is, and that tells us about our patient's hydration status. Okay. Alrighty, next, if you will go ahead and lay back for me, we're going to take a look at your abdomen. So if we come to the side, we would be looking at the shape or the contour of his abdomen, and his is flat. And then if we come more towards the feet, then we would double check for symmetry, checking for any type of pulsations, any abnormalities. Have you had any problems with your stomach?
No.
Okay, very good. So we'd be looking also around his umbilicus for any type of pulsations. Very good. Okay, so next I'm going to take a listen to your bowel sounds. So we'd start here in the right lower quadrant. And then once we hear sounds, we'd move around to the right upper, the left upper, and the left lower. Then we'd flip to our bell, and we'd listen here for any vascular sounds or bruise noted. Here we're listening to the aortic, the renal, and the iliac. And here we'll be checking for any type of enlarged organs, inflammation, anything like that that we would be able to feel. No pain or tenderness when I did that?
No.
Okay, very good. Go ahead and sit up for me. Again, skin characteristics are normal, there aren't any issues. Okay, next we're going to take a look at your upper extremities. So I'm going to be feeling skin temperature here. Can you put your arms out for me so I can take a look at them? Skin is warm and dry. There are freckles noted on both arms. And there's also equal hair distribution, which is good. And take a look at your fingers for me. Checking your capillary refill, making sure that those are less than 2 seconds, which they are. Okay, and then can you grip my hands for me? Good, making sure that its grip is equal bilaterally, which it is. Okay, next I want you to make this kind of shape for me. Here we're looking at the nail angle. There is a little bit of a gap in between, but we want to make sure that that is less than 160 degrees, which it is. Very good, thank you. Okay, next we're going to be checking your range of motion. So what I want you to do is I want you to bring your arms out and up, looking at your shoulders. Very good, and then if you'll kind of come forward and do the same motions up and then back down. Okay, and then I want you to take your elbows and do an extension there. Good, and then I want you to kind of move your wrist around, wiggle your fingers for me. Okay, now we're going to check against pressure, okay? So I'm going to have you kind of go up against pressure, good, back down, then kind of come forward like we had before. Good, come back down. Okay, now we're going to do a flexion, so there and the other way. Good, try to rotate your wrist, you check your fingers, and then can you also kind of push down on your legs for me? Very good, so you have full range of motion, and your strength is a 5. Next, we're going to be checking your lower extremities. So here we're also looking at skin characteristics. Skin is warm, dry, and intact. There are some bug bites noted, but there's equal hair distribution. We are also noting here that there's no pretibial edema. And then we are also checking pulses. Pulses are a 2+. And then also checking capillary refill here, making sure that that is less than 2 seconds. Very good. Okay. Next, I also want to check your range of motion. So if you will kind of take your leg and go kind of up and out with your hips, good, same thing. Okay, and then if you can kind of do an extension with your leg and then back. Good, same thing. Good, and then if you'll rotate your ankles and then wiggle your toes for me. Very good. Now we're going to do the same thing against pressure. So if you will kind of move up and out for me. Good. Okay, and then against pressure here. Back. Forward. Good. Back. And if you'll move your ankles against pressure for me. Good. Good. Again, range of motion is full and strength is a 5. Okay. Next we're going to check some sensation. So first we'll do the tissue test. If you will close your eyes for me, and I want you to let me know when you feel this tissue against your face, okay?
Okay. Yes. 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 Yes.
Okay, very good. Next we're going to do position sense. So I'm going to have you hold out your hands like this, and I want you to let me know whenever I'm moving your finger up and down. You're going to do this with your eyes closed, okay? Ready?
Up. Up. Down. 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 Up.
Okay, very good. Next we are going to check to see. I'm going to have you close your eyes and hold out your hands. We're going to check the stereognosis test. Okay, hold out with your right hand first. I want you to name what item I'm putting in your hand and your eyes are closed.
Battery. Cotton swab. Pen.
Okay, other hand.
Chapstick.
to do a sharp dull test. We'll do this on your arms and your legs. Okay, you can go ahead and go. Flip your arms out, keep your eyes closed for me. And I want you to tell me if you're feeling a sharp or dull. I'm gonna let you test it first, okay? So this is sharp, and this is dull. Okay.
Sharp. Sharp. Dull. 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 Sharp. Sharp.
Okay, we're gonna do the same thing on your legs.
Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull.
Okay, good job. That's sometimes harder than it seems. Okay, so next, what I want you to do is we're going to test your finger to nose, okay? So I want you to, you're gonna touch your nose and then move it to my finger, okay? There you go. Okay, switch to the other hand. Good. Okay, next, if you will take your heel, and we're gonna take that heel and put it to this shin, and you're gonna kind of break down your leg. Good. You can do the same thing on the other end. Very good. Okay. So next, if you will kind of hop up here, we are going to check your reflexes. So we need your legs dangling. Good. Your legs relaxed.
Yes.
Okay. Ready? Very good. And then I'm going to use this pen and come around the bottom. Good. Very good. Okay, so what I want you to do is if you'll kind of hop up and come over here, I'm going to have you walk normally. Again, looking at his gait, and he already said he does not use any type of mobility device, no abnormal movements noted. Okay, now I want you to take your, do heel to toe like you're walking a tightrope. And again, he should be able to keep his balance. Okay, if you'll stop there, put your feet together and legs at your side, or hands at your side. Good. Close your eyes and we're just gonna assess for 30 seconds, making sure that you're being able to keep your balance, doing the Romberg test, making sure that you aren't swaying too much. A little bit is normal, just your body trying to keep equilibrium. Okay, and then if you can reach down and touch your toes for me. Good, and then kind of do a backwards. Good. No pain or tenderness there?
No.
Okay. All right, well I think that completes our head to toe assessment. Thank you for watching.